Good afternoon, class. This week we have been tasked with discussing certain aspects of telemedicine. Primarily, we are to discuss the impacts of virtual nursing as well as telehealth implementation as a whole. So to start off then, we need to answer the question, what is virtual nursing? Jennifer Ball, the director of virtual care at St. Luke's Health Systems in Kansas City, Missouri, describes the role of the virtual nurse as effectively an augmented float nurse, sort of, but more dedicated to specific tasks that are designed to allow the bedside nursing staff more time to tend to their patients' physical needs. The role of the virtual nurse is to take over some of the responsibilities that do not directly require a physical presence, such as admissions history, medication reconciliation, general and discharge teachings, procedural checklists, answering questions, and so on. While on paper this may sound paltry, the time saved for the bedside nurse and reduced charting opens the opportunity to handle significantly more hands-on work and to consider patient-specific changes and interventions more thoroughly. The pros and cons of virtual nursing should be relatively obvious to most of us. Having an extra set of eyes and ears on a patient can increase interaction between a healthcare system and that patient, and having a nurse available virtually can increase the feeling of safety for patients in participating in their own care, as well as allow for a more open discussion of that care. It goes without saying that a reduction in charting for the bedside nurse gives increased time for physical intervention. However, there are barriers that do exist to the implementation of this type of nursing model. Primarily, technological literacy, regulatory issues, and a willingness of insurance to pay for this type of care all present as hindrances to implementing this nursing model. An unwillingness to change by both the patient population and the current nursing staff, as well as a steep learning and developmental curve for this unique and budding caregiver model type, will negatively impact the usage of this model type as well. A 2019 article published in Nursing Administration Quarterly titled Virtual Nursing, the New Reality in Quality Care sought to quantitatively assess the implementation of this exact nursing model at two sites, deemed Site A and Site B. The authors found that, over a 2.5-year period, Site A saw post-implementation average improvement of 6.2% in the communication of possible side effects of new medicines, 8.2% in understanding the responsibility of managing personal health, and 17.4% in understanding the purpose of taking medications post-discharge. Site B saw an average post-implementation of 8.5% in nurses listening carefully to their patients, 12.7% for clear communication by nurses, and 17.4% again of communication of possible side effects of new medications. A yearly survey of staff satisfaction and teamwork rating by the Agency for Healthcare Research and Quality found that Site A improved an average of 5% per year, and Site B improved an average of 27% per year on both annual post-implementation surveys. While there is much work to be done before widespread implementation of this style of nursing is adopted, early research shows an obvious positive trend in patient outcome and staff satisfaction. As with the previously discussed model of virtual nursing, telehealth as a whole is the implementation of virtual and remote healthcare options for those patients who may have unique needs or may not have adequate access to the systems that are needed for their care. The most easily envisioned form of the telehealth is the remote doctor visit, where a patient that has a geographic or time constraint may opt to have a virtual meeting with their doctor to discuss healthcare needs. I am personally very familiar with this style of doctor's visit and have even have the option to use Teledoc as a sort of low-level emergency service through CAMC free of charge. In my experience, the best use of a Teledoc conferencing is for low-level healthcare issues that may require a doctor visit but may not merit a physical visit to the ER, such as acute nausea or a mild persistent cough. Again, in my experience, I was able to receive a prescription for both of these symptoms that alleviated them completely within minutes and set up a scheduled follow-up without ever going to the hospital. This saved not only my time, but also the time and the resources of the urgent care or emergency departments that I may have visited had I not had access to the Teledoc service. My experience is not unique, though. A 2021 study of patient satisfaction with remote healthcare services, published in Telemedicine and eHealth Journal, found that patients felt the quality of care delivered by telehealth services was at least equal to or greater than healthcare they have received in the past. The same study found that 87% of patients reported as being satisfied overall by the care they were provided, and 54% would be happy to continue using telehealth in the future. The primary detrimental factor in the likelihood to use this service in the future was, of course, age, with groups 35 years and older being less satisfied than groups 18 to 34 years of age. This should come as no surprise to any of us, as technological and healthcare literacy, as well as a willingness to engage in and change, are the biggest detrimental factors hindering widespread adoption of telehealth. Still though, for patients that either don't have the time or are not close enough to reasonably travel to a hospital, telehealth services seem to be a godsend. Ultimately, only time will tell the effectiveness and implementation styles of virtual healthcare. In a world that is becoming more digital every day, though, it seems that widespread use of this style of healthcare is an inevitability. For what it's worth, this nurse is incredibly excited about what the next few decades will hold with regards to the continued implementation of technology in healthcare. Anything that makes access to healthcare systems easier for the general public is a win-win in my book. Thanks for taking the time to listen, and I look forward to hearing what other folks have to say about their experiences. Have a good week, folks.